Welcome to Motivational Enhancement, Unit 1, Group 3. This is part of the Quickstart Guide for Recovery from Addiction and Co-occurring Disorders by Dr. Dawn-Elise Snipes. Motivation is essential for change. It helps you identify both the reasons that you want to make the change and some of the benefits of the old behavior so you can make sure that those don't trip you up in your change process. Motivation helps you keep going when the going gets tough. Think about a time when you have wanted to do something or needed to do something like spring cleaning and you just weren't motivated to do it. It was kind of like drudgery, getting up and getting started. Motivation gives you that little oomph. It's kind of like having the wind at your back. It's important to remember that motivation is different for different goals, though. In recovery, we often talk about changing people, places, and things. You may be ready to start changing the way you think. You may be ready to start changing places, not hanging out at the bar or not going to your dealer's place. But you may not be ready to start changing other aspects of your life. That's okay. It's important to understand where your motivation is for changing each one of those things. Motivation also isn't just something that you have. It's something that you've got to pay attention to, and it will decrease over time if you don't give attention to it. So just like your New Year's resolutions, you start out, you're gung-ho, you're going to the gym or doing whatever you're doing, and you're all excited about it. If you don't maintain your motivation and regularly focus on all the benefits and how awesome it is that you're getting in better shape or whatever it is, your motivation will often wane and you'll get up, 2 months into it and be like, do I really want to do this today? It's important to make sure that you pay attention to your motivation and strengthen it every single morning. There are 5 different aspects of motivation we're going to talk about, and I use the acronym PACER to help you remember them. Physical, obviously. Affective, which is your emotions. Cognitive, which is your thinking. Environmental, which is obviously your environment. And relational, or your relationships. In this video, we're going to talk about physical motivation. Physical motivation is how this new behavior, how your change, how your recovery is going to make you feel healthier or feel better. So spend a few minutes writing down in your journal how the new behavior is going to make you feel better by helping you have more energy, less pain, less sickness, and possibly help you manage some chronic health conditions. After you do that, spend some time thinking and asking yourself, how does the old behavior make me feel bad physically? And a lot of times it may contribute to fatigue, it may contribute to pain, you may feel depressed or hungover or sick afterwards. However, the old behavior makes you feel bad, we want to highlight that so you remember some of the reasons that you want to change. And as I said before, there are probably some benefits to the old behavior or you wouldn't have been doing it. It's important to acknowledge those. What is it that this behavior is doing for you? What did the old behavior do for you in terms of pain management? Helping you manage your energy, helping you sleep or relax. Spend some time writing down in your journal what the behavior did for you, what your addiction did for you. And then identify, guess what, 3 ways that you could achieve that same goal. So if your addictive behavior helped you relax, what are 3 alternate ways that are healthier that you could use to help you relax now? And you may not know all 3 ways. Start identifying some things that you might be willing to try. Once you finish that, think about in the past how your physical health, how pain, how sickness, how lack of energy, any of those things have contributed to addiction relapses in your past. Once you've really thought about that for a few minutes, to start thinking about how important physical health is in your recovery. Also think about how physical problems pain, fatigue, sickness have contributed to feelings of anxiety or depression or guilt. Remembering that physical health may trigger low mood may trigger addictive behaviors.